Right now, all across social media, there's a massive push to get locked in. People are getting into new routines and the pressure to transform is higher than ever. And for a lot of people, that means one thing: hitting the gym, bro. My feed's flooded with GymTok clips. And sure, some of it's solid fitness content. I get it. I own a gym too. But there's a dark side to this trend. A pursuit of virality that prioritizes extreme weight, dangerous form, and impossible challenges over real sustainable health. And as an orthopedic surgeon, it's not just about cringeworthy. It's a clinical preview of my next freaking patient. So today, we're reacting to the wildest GymTok fails out there.
Sometimes I like to keep the windows open and just scream loud so like people think we're having sex or working out, they're not sure.
We're gonna break down exactly what's going wrong in these clips. What injury is waiting to happen? And most importantly, how you can stay safe while chasing your fitness goals. Let's get into it. For returning viewers, thank you for your support. Do me a solid and give the video a like and let me know what's the wildest thing that you have seen in the gym this year. If you're a new visitor, welcome to the channel where you leave smarter than when you arrive. Watch the video first, and if so inclined, join our army of intelligent interns learning about health at the end. And don't forget to subscribe with notifications so you can be alerted when I post content that you'll enjoy. That said, let's get into it. Let's start with a group I always want to support: the well-intentioned newbies. It's awesome that these people are in the gym trying to make a change, but this is where foundational form is everything. What looks like a simple squat or a press has specific mechanics, and getting them wrong from day one, even with lightweight, sets a dangerous precedent that can lead to long-term wear and tear or even an acute injury.
Now let's do some jackhammer squats. Put your hands in front of you like this, just relax, and the squat up and down, but fast.
Let's look at a couple of classic examples.
One,
Oh, whoa.
two,
Whoa, whoa.
three,
Ah. Oh my God. Bro.
7, 8.
Is he even supporting the weight at all? Oh, Lord. I don't want to assume, but clearly this is a beginner. So kudos to him for getting into the gym. However, I do have to say this: his form is atrocious. If you look at his back, you can kind of get the sense that there's a little bit of a curvature there. So I would venture to guess that this person has a scoliosis, and as a result of that, he's got what we call pelvic obliquity, where his pelvis isn't entirely level. So that makes it look worse than it is. And that doesn't mean that he can't lift weights. It just means that obviously he needs to do so with best form as is possible. We can see here that he's got two spotters that are really, for the most part, lifting most of the weight. And we know this because when you look at his neck, we can see during some of the repetitions that the bar is not even actually resting. He doesn't really go through a full range of motion. He doesn't even go to 90 degrees. The people cheering him on are trying to make him feel comfortable, and they're not really there worried about the form. So again, kudos to him for getting into the gym. And you know, the gym is a vulnerable place, and people supporting you there can make all the difference. All right, I don't know yet what's gonna happen, but I can see with the caption, I was doing this squat for the first time and then this happened. Okay, so let's see what this is. Oh, jeez, Lord. Not too bad. Not too bad. Oh, God. Yeah, oh no, definitely. Even the caption says, definitely this is the first time that she's trying this move. So you can understand why she may not have the strongest form. I will give her props for at least doing this on the Smith machine so that she's got a little bit of protection there and a little bit more control. At least we know that the path of the bar is going to be straight up and straight down. When she's going into this squat, her hip has a little bit of internal rotation. Once she's starting to go down, and especially as she starts to fatigue, it's more likely that her knees are gonna fall into what we call valgus collapse. As you're squatting, the ideal position should be that your knees slightly track out over the outside edge of your foot. Look down at your toes And if you can see your big toe inside of your knee when you're squatting, then you have enough valgus to compensate for the varus at the joint surface. The issues don't stop after the beginner phase. Next up, we see what happens when people get a little too comfortable or even a little too confident. Before we even start the video, I can say this looks to be in competition. So this is clearly somebody who is experienced. I'm assuming she knows how to squat. She's got her knee wraps. She's got her weights, or her weight belt, I should say. She looks like she knows what she's doing. Oh, God. Okay. Woo. Cooked. Yeah, no doubt, no doubt. Now, obviously, this looks probably to be a PR she's going for in competition. When she comes down, we can see that her legs cave in. We talked about that previously, valgus collapse. When she comes back up, you can see that she's holding the back of her leg. And it's hard to see initially whether she's holding her hamstring or her buttock, but it appears to be her buttock. You can see that initially she has pretty good form as she's coming down, but as she gets to the bottom and she starts to run out of strength, she starts to go into valgus collapse. So both of her knees, instead of just one side, both of her knees cave in towards the midline. And as soon as we see that, we know that she's kind of run up against the limit of her muscular strength, because her glute muscles, which are the muscles that help to hold your pelvis level, those muscles basically give up the ghost. Although people think that the squat is primarily a quadriceps or the front of the thigh movement, depending on where you position the bar and how you drive up out of the ground, it can be either a movement where you are pulling yourself up over a planted foot with your quadriceps, or you are driving yourself up over a planted foot using your glutes and your hamstrings. And in this case, I think she, because of the position of the bar and the position in which she is standing, she was using a glute and hamstring dominant driving motion to push herself up. And it looks like she may have injured her gluteal muscle, potentially even her hamstring. But at least one thing I'll say is thank God for spotters, because she would have been toast without them. Come on. Okay, again, thank goodness for spotters. I'm not sure if that's entirely staged, but that can happen. People don't always need to necessarily be in a gym to get a good workout, but I will say that there are major benefits to being in a gym setting when you run into trouble, because people can help out when stuff like this happens. Either she's going for a PR, or this is further along in her workout, but she had nothing left in the tank. She's got bumper plates here. The beauty of these is that it's very easy to bail. You just let go of the weight and it drops to the ground. No harm, no foul. Even in this lunge position, she could still just drop the weight. She's in the middle of the bar, so even if she dropped the weight, she's got the plates, which are rubber, on both sides, and her legs are gonna be protected. At worst, it's gonna make some noise. It's gonna draw some attention to herself. So now we're moving into dangerous territory, the ego lifters. This is where confidence completely outweighs capability. You'll see people sacrificing every principle of good form for more weight, more speed, or just plain bragging rights. They're creating high-risk situations where one wrong move doesn't just mean a failed rep, it means a trip to the ER. So let's break down the anatomy of these disasters. Oh, that's a lot of weight. 225. Jeez, buddy. Okay, so 225, 35, 35, 295, and then some 25s. So another, listen, this dude is bench pressing an impressive amount of weight. Like, he's close to 400 pounds here. This guy is strong, no doubt about it. But, so he's doing this without a spotter. There are people, and I've done videos on this in the past, there are people who have themselves in this exact manner right here. I don't want to criticize too much because again, he is lifting a huge amount of weight, but he's got a huge arch in his back. Depending on whether you are somebody who competes in bench press or not, there's a certain amount of arch in your back that could be allowed because of that. But generally speaking, if you are just doing bench press in a non-competitive manner, it's best to keep your back on the bench, keep the entire spine stable along the bench, and press from your chest, and just to keep everything under control on the bench.
Nothing beats a jet to
Okay.
holiday. And right now,
Another small dude. Ah, God, buddy boy. Oh, Lord. Again, we have somebody here who is clearly very strong. With his overall cadence, this weight is relatively light for him. You can notice when you look at his hands, he's not gripping the bar with his thumb on both sides, but rather he's got all of his fingers behind the bar on the caudal side of the bar, the side of the bar towards his head. There are a number of different reasons for doing this, but this is a way that allows you to get more of your palm on the bar. So if you can put your finger, including your thumb, on the other side of the bar, it allows your palm to be more parallel with the floor. And so it's an easier platform and it allows you to press more weight. However, the downside of that is that if you are not careful, that sometimes if you're pressing the bar explosively or you become very fatigued, the bar can roll off your palm, off the platform, and drop onto your chest or your neck. Accidents happen, and sometimes it is just in the blink of an eye, you can go from crushing it to being crushed by it. In terms of injuries that you could suffer, you could, depending on where the bar hit, you could crush your trachea, you could crush your larynx. So my man here has 1, 2, 3, 4, 5. Oh, so 5 times 90 is what, 450 plus the bar. So it's over 500 pounds here, deadlift. So this is an impressive deadlift. And if you look at this guy, you know, he's relatively lean. This is impressive. Whoa. Good. Nice. All the way out, all the way out. Yes, yes, yes. Whoa, oh, brother. Oh my God. I suspected that was gonna happen. He is working hard. We can see that. He is shaking as he's driving up to the top. He got up relatively quickly and relatively easily. He was able to get to full extension, so I gotta give him props for that. You know, we sort of have to figure out what is a normal amount or a healthy amount of shaking and what is like, oh my God, help me shaking. He is strapped in here. In order for him to get up into this position, he has had to brace his core. So basically he's doing what we call a Valsalva, which is where you close off your airway and you trap all of the air inside of your thoracic cavity. And what this does is as you are compressing your thorax and compressing your rib cage with this air that's trapped in, you are now making the thorax very rigid. This is allowing you to exert a lot of force and keep this segment of your spine very stable. When you do that, your vena cava, which is the massive blood vessel that brings blood from your lower extremities back up through your thorax to your heart. Also, your jugular veins, which are bringing blood from your brain back to your heart. You have stopped blood return from your lower extremities back into your chest and from your brain back down to your chest. You can only maintain that for a short period of time before the computer has to be turned off or the computer resets and you go night night. The other thing is that when you're working hard, a little bit of shaking is often normal. Just means that your nervous system is firing at max capacity and you may get a fine rhythmic tremor in the muscle that you're working. And this is just a sign of fatigue and it's cue that you're near the end of your set. But generally, that's safe. On the other hand, the help me shake, or something that's a red flag, when you see that you have shaking that is very large, jerky, and uncoordinated, this is where you need to stop. If your knee is buckling side to side or your core is shuddering, that's like a significant joint wobble. It means that your stabilizers are failing and you are on the verge of losing control. Is it dangerous to lock your knees or lean back? What I often tell myself, what I often tell people when I'm coaching them in the gym, is that they should think about a line that runs from their foot up to their shoulders. There are 3 points on the line: your feet, your hips, or your shoulders. And when you're deadlift, you're driving to just bring your hip back in line with the first 2 points. So that's it. You're not trying to lean back. You should just be driving up, fully extending, and then putting the weight back down. But obviously it looks like he was working for a PR here. He was holding it at the top so that he could show, yep, I got this weight, I have it under control. I'm assuming, or at least hoping, that he wasn't significantly injured. I don't know how much weight this is, but it looks like it's a lot. These don't look like these are official weights. Wow. My goodness, that's a lot of weight. Even for him just to walk that back. Giddy up, giddy up. Whoa, wow, wow. Okay, good thing that there were spotters and he bailed quickly. It's not exactly the way that I would have bailed, but people get very confident when they're holding the weight on their shoulders. When you're standing up in an upright position and all of your bones are basically stacked atop one another, then we have the benefit of using the stability of our skeleton. Bones love to be compressed, and that is where they are at their strongest. Even though that's a heavy ass weight, you can hold that amount of weight and feel relatively confident. But as you start to put yourself into an unstable position, once you start to bend your legs, then we quickly start to see, how strong or how much strength that you have. They are relying on skeletal strength rather than on muscular strength, and the two are not necessarily the exact same. Me and my bro couldn't find any 45s. Then we see this. All right, so that kind of gives me an idea what's gonna go on. Oh Lord, jeez, dude, come on, man. He has a very limited range of motion. So, he's got every plate on the rack, all about ego lifting. We didn't really see a fail per se in this video, but it's so extreme. I don't see why anyone would ever do that as a fitness goal. This reminds me of a guy that I see on Instagram all the time, El Campeon, who is like the crown prince of ego lifting, puts every plate on, and then he has like a sort of 1-inch range of motion that he works through. I don't even know what is the purpose of that other than for ego lifting, because I don't even think that could have any kind of benefit for you in terms of your musculoskeletal strength. And generally speaking, I think that this type of behavior is basically unsustainable and it's counterproductive for actual fitness. What do we have here? 1, 2, 3, 4. So this is a good, reasonable deadlift. It's not as heavy as the last guy we saw, but this is boom, boom. Okay. Nice. Again, a guy doing a deadlift, and like the one that we saw earlier on, he passes out. He's using a little bit of a different technique. He's using a sumo, not exactly a sumo style. His legs are not quite that wide, but more of a sumo style of deadlift. And just as I mentioned before, in order to lift up the weight, you have to tense your core. Well, you don't have to, but this is the way in which you can generate the most power. When you're in an upright position and there's not enough blood flow to keep the computer going, your body says, well, I need to bring the body to a level position as close to the floor as possible so that we can get as much blood to the brain as it can. This is why you would have a syncopal episode like this. I've not had this happen exactly myself, but I've sort of had the prodrome before this, where I've been pushing myself very, very hard. You kind of get what's, people refer to as tunnel vision. Everything that you hear starts to be very, very muffled. The combination of the altered eyesight and the sound tells you that you're on the verge of losing consciousness. So the simple takeaway here for viewers is that your body isn't failing, it's protecting itself. Fainting after a heavy lift is a clear sign you've pushed your cardiovascular system beyond its current limit, not just your muscles. So keep that in mind when you're lifting heavy. And to be honest, this is kind of one of the most important distinctions to make in the gym, knowing the difference between muscle fatigue and injury pain. If the pain is sharp and if it instantly changes your movement, you start limping or you can't lift up your arm or whatever, you have to favor one side, that's your body telling you stop immediately. This is damage, not fatigue. So thanks for joining me in this discussion about the crazy world of GymTok. Let's wrap it up with a roundtable analysis from the intern army. What are your thoughts about fitness social media? Let me know in the comments. And if you dig what I do and want to support our mission even more, consider becoming a member of my channel so that we can grow our creative team to serve you better. And don't forget to follow my gym, Hume 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. Otherwise, as always, that's been a word from Dr. Chris Raynor, not your everyday ortho, where we see one, do one, teach one.